Hi, this is Dr. Tom again, and today I'm pretty excited about our next technology. This next technology is called the ARP Wave. The reason why it's pretty cool or exciting to me is it's an easy device to use in terms of it's portable, so you're not like stuck to an electrical outlet. It's got a rechargeable battery pack in the back, and I've used this in all kinds of ways where I would put in my backpack, so it's now attached to me, and I have my hands free while I'm doing other types of movement patterns. So the way it works is it basically sends electrical signal to stimulate different parts of the body. So you have these electrodes that are adhesive. So the back is sticky. You can put it on any part of the body you want. And the leads connect right into the ends of the electrodes. And then you have some controls here to make the signal stronger, faster, slower, weaker, whatever parameters the person controlling the device wants to use. Now, the reasons why it's so cool is we can use this to either enhance the strength of contraction of a muscle group, or we could use this to help get rid of pain. So in the next couple of sections, what I'm gonna do is talk about the different ways we could use this with different types of patients. So the way that athletes would use this technology is pretty clever. So let's just say you had a muscle group that was a little weak or wasn't firing, and you wanted to bring it up to the same level of performance or strength as the same muscle group on the other side of the body. What we could do is we could take the leads, we could plug them into the ends of the electrodes, and I'm just gonna demonstrate it like on some forearm muscles so you can kind of see how it's connecting. And I would basically then turn on the device and send a signal to kind of get the muscles to be stimulated electrically. Now I can do that at rest to try to get more signal here to get my brain to connect better and increase my strength that way. Or I can actually do it while I'm lifting weights. So let's just say I'm doing an exercise, in this case for the forearm muscles, I would do some sort of wrist flexion type device. So I could use electricity to help enhance my ability to do the movement pattern. And it's almost like, in that regard, it's like using electricity to do a forced repetition. And the significance of that is over time, you'll get stronger faster. And then what we can do is, as athletes get stronger and they adapt to it, we can increase the signal strength. So we could use it like on their quadriceps to help their legs get stronger. We could use it on the hamstrings or their hips to help their extensor strength in the posterior chain. So there's a lot of application for this for improving athletic performance in sports. And it's a tool that a lot of athletes really like. The way we would use the ARP Wave with someone who has cancer really depends on whether it's a physical performance issue or whether it's some sort of pain or maybe a form of neuropathy. So let's say, for example, someone's very frail and they just have difficulty standing. One way that we could use the ARP Wave is we could use it by applying the electrodes to the weak muscles and use electricity to help that person stand up or get stronger. So we basically maybe have them like sitting in a chair and trying to stand up just using their legs without their arms while we electrically stimulate the different muscles involved in standing. And as we do that over time, they're gonna stand easier and they're gonna get stronger, and eventually we can increase the strength of the signal. And then we get them to the point where they don't need the signal, we can actually use loading like dumbbells or barbells to increase their leg strength while they squat or something like that. Another application though, if let's just say they have pain, and that pain may not be due to chemotherapy or it may not be neuropathy, it'd be some other type of pain, we can roam the body. We have these sponges that we wet, and we could find where there's pain signals in the body and then use the electricity in a very clever way to help understand the compensation in the nervous system and then basically eliminate the pain that they're feeling by strengthening the areas that need attention. So basically the way it would work is we would find an area that is painful. We would then put one of the electrodes after we find that area on that spot, and then we would go and search the other rest of the body, find a second area, and then we put the other electrode on that other area. And then we would use a low level of electrical signal while they do some simple movement patterns. And we basically help teach their nervous system that they could move pain-free. And through practice and by increasing the signal strength, we get them to be able to move pain-free. And most people are really excited because it means no drugs, no supplements, They don't have to keep seeing a doctor all the time to get pain meds and things like that. And it works for whether it's back pain, knee pain, shoulder pain. It doesn't really matter the type of pain in the body. It's a really good tool. But let's say someone was doing chemotherapy and now they got a neuropathy in their hands or their feet. And typically it may feel like a burning sensation or some sort of ache. Well, in that case, we basically do the same sort of concept where we're going to roam their body, find out where their pain spots are, and then we're going to electrically stimulate those areas while they do some movement and teach their nervous system how to get out of pain through exercise. And eventually they'll be able to move without any pain at all. So it's a quite versatile tool that many of our cancer patients really enjoy using because they could feel immediate results, meaning like they come in with their feet or hands on fire and within days they don't have any tingling or burning sensation, and then they can get rid of the drugs that they were on before to manage the pain, and that usually makes everybody much happier. So I talked about how we could use the ARP Wave for patients with cancer that have neuropathy. But sometimes other types of patients have neuropathy. For example, people with diabetes, anyone that's had surgery, sometimes after the surgery, there's burning or tingling in the fingers or the feet. So there could be other conditions that result in neuropathy. And so we can use the ARP Wave to help those conditions or help people afflicted with those conditions as well. And the protocol would still be the same. We would basically roam the body, find what we call hot spots. And after we find those hot spots, we would then apply these electrodes, and then using electrodes with the appropriate electrical signal, we could help that person move and get out of pain, and eventually we get them to a stronger and stronger signal, and they'll get basically to a point where they can move pain-free. It's a very clever way of helping people get out of pain without resorting to drugs that maybe people don't want to be on because of the side effects. It also is one of those things that as people use it, not only do they get out of pain, but they get much stronger. So imagine, one of the limitations with many medications is maybe you take it and your hands or feet or some other part of you don't burn, but you're not getting more physically fit, right? You're not getting stronger, you don't walk better, you just have less tingling or numbness or pain. The advantage of a technology like this is not only do you eliminate the tingling or the pain or the burning sensation, but you physically move better, you're physically stronger, you're able to return to more activity in life and then get, let's say, a greater sense of satisfaction because your quality of life is much better. So it's a really good tool for anyone that's dealing with neuropathy, regardless of what was causing the neuropathy in their bodies. Another way that the ARP Wave technology can be used is to take the electrodes and just kind of place them on muscles that are maybe not responding if you're trying to get stronger at a lower level of intensity or signal strength, and you can just leave them running while you're sleeping, or you can leave them running while you're doing something. Let's say you come home at the end of a long day and you want to spend some time with your family. Like you don't want to neglect your responsibilities to your kids or to your wife, your husband, but at the same time, you may want to try to improve your own health. So one of the great things about this tool is, let's say, like for example, if you had back pain, you could put the electrodes on your back, you can let it run at, let's say, a very low level, and you're getting stimulation of those muscles for hours. So like the battery will last quite a long time, and you could literally be having dinner, you could sit and watch a movie with the family, you could play a board game, so you could actually do things, like with your family while you're quote unquote still making progress or getting better. And the same thing could be done for any muscle group in the body. There's also applications, like sometimes people talk about, the tone of my abdominal muscle, like they may have like weak abdominal muscles, and they're like, it's stretched from maybe years if they were too heavy. Let's say they carry a lot of central body fat. Well, one of the things you could do is use a technology to actually strengthen the muscles and increase the tone. And what's kind of cool about that is, let's say if the muscles and abs were stretched out a lot, your circumference, your waist is going to be pretty big. just by using this device consistently, you actually improve the tone of the abs. So get someone, let's say, whose waist is really wide, and it gets their waist very narrow. So it's not gonna like get rid of body fat instantly, but what it is gonna do is increase the tone of the front part of the abdominal wall, so that now you're not pushing everything out. It's kind of keeping everything nice and tight inside of you. So it gives the appearance like you lost all this weight around your waist, which is good, but also increases the strength around the spine, so you have more structural stability. So it's kind of like a 2-for-1 special. So you look better in clothes, and you also have better support around the spine. So there's a lot of other applications. I mean, basically it's limited to what the person running the device can conceptually think of. I've used this device with people that have had spinal cord injury. I've used this device with people that have had head injuries, where they have difficulty controlling their bodies or different parts of their body. I've used it with people with kinds of arthritis type conditions. So it's certainly got a lot of applications, and I would tell people, if you're not sure, just fill out the form on our website, make an appointment to come in, and let's just do one session and then see how you respond. Most of the time when people do the session, they want to book a whole bunch more sessions because they enjoy the results that they're experiencing. So if you'd like to find out how the ARP Wave technology can help you, just go to Causenta.com and fill out the form on the home page, and we'll get in touch with you right away and get you scheduled to feeling better than ever before. If you or a loved one is suffering or dealing with an issue, and where that issue has a diagnosis or no diagnosis, or if you're just tired of coming in second place, just go to www.causenta.com and fill out the form where one of our professionals can schedule a call with you and review the options that we have. They're going to explain to you how we work and how we can help you or your loved one, and then just do what they say so that we can actually help you.